Thank you all so much for joining us today. Our session today is focused around the healthcare world, and these sessions are sponsored by our new AHEC partners, which is an acronym that stands for the Northeast Wisconsin Area Health Education Center. They have found some collaborative partners and people that work in health related occupations to showcase the different varieties of health careers that are out there. And it's interesting, if we would have talked about this in 2019, I don't think public health would have come to the level of awareness as it has in 2020. And we're really excited to be able to showcase our special guest today. We have Lily Ann Payne, who works for the health department in Milwaukee County, and she's going to be sharing with us her experiences in this role. So I would love to first and foremost introduce Lily Ann. And the first thing I want to have you share is, like, if you could just share with us your journey to this point, because I know
Yeah.
you've had some really great experiences all the way from high school through now, and just tell us a little bit about yourself.
Well, good morning, everyone. I'm noticing in the chat that some might have to leave soon. So just a reminder that this is being recorded. So my name is Lily Ann Payne. I am the very first chief of staff for the City of Milwaukee Health Department. The Milwaukee County does not have its own health department, and earlier on in the outbreak, when an emergency was declared, a public health emergency was declared, that put our former commissioner, Dr. Jeanette Kowalik, in charge of Milwaukee County for the pandemic. Think back to the Safer at Home order. So this was March 2020 until May 2020 that we had that statewide Safer at Home order, and then the city of Milwaukee had the Moving Milwaukee Forward Safely order. So, what does it mean to be chief of staff for the City of Milwaukee Health Department? How did I get here? And thinking back to high school. So, when I think back to high school, so I'm a millennial. I'm what you consider an elderly millennial because I'm on the older scale of millennial status. And I graduated from high school in 2000. So the summer between my sophomore and junior year of high school, I was part of a program at the University of Wisconsin-Milwaukee called the Health Careers Bridge Program. The goal for that program was to get folks from the demographic I fit. So I'm not first generation to go to college. My mother is. So I'm second generation in my family to go to college. I was first in my family to be interested in medicine, right? My mother had healthcare experience, and I have a sister that was a phlebotomist. But as far as straight track to science and math, the STEM, that was me. And this program was to introduce kids like me that were from minority status home. So City of Milwaukee is a majority minority city. So that's our demographic is set up ethnically speaking as 38% Black African American, 34% white, 10% Latinx, and 4% Asian. So getting more Black and Brown kids interested in the sciences, we received the same training that a certified nursing assistant would receive. We had mentors that represented different fields, and it was a summer program. So I want to say that was from maybe late May until August. We learned those skill sets, practice on like dummies or fake bodies to the skill of testing blood pressure, taking someone's temperature. We took tours of different universities, historical Black colleges, as well as different schools within the UW system. And then we were assigned to different hospitals. So it's either Froedtert or Children's Hospital, and at that time, Sinai Samaritan. And we practiced these skills when it made sense to practice those skills in a medical setting. So following a pharmacist, following a surgeon, looking in on a surgery, delivering medicine, and bedside manner. So helping to greet patients, helping to change bed sheets, things like the hands-on bedside manner, as well as the, again, in your face, real time interaction with patients. And that was as a high school student. So at that time, so again, this was late 90s, college wasn't a question. Education was something that was valued in my home. And I was very familiar with the UW Milwaukee campus from the Health Careers Bridge Academy as a high school student. I was also part of TRIO programs. So that is a federally funded program, again, trying to target those from disenfranchised and marginalized communities. So meeting certain criteria of being at a certain income level for your family, first or second generation to go to college, having your gender and ethnicity status as, again, someone from a minority demographic, and getting more representation and more representatives from, I say, communities that are divested in, or when you look at property taxes and budgets, what communities get most of those dollars? So communities that don't get most of those dollars. And I was in the pre-college academy. I was in college for kids. All of these enrichment programs that, again, I didn't have the agency or autonomy as a child. Those were decisions made by my parents, but it was something I valued and thought was fun. And then as an undergrad, still part of the TRIO family, still part of TRIO programs. It was a very competitive process. I had to apply to become a Ronald E. McNair Scholar. And that program is a post-baccalaureate program. So getting more folks like myself and those that identify as folks as myself into graduate programs. So learning about research and asking your own research question and doing your own study with a mentor and a certain data set. And data set is made up of real people. I got in and I was assigned a mentor from the Department of Psychology because that was the major I had hoped to declare. And I looked at what was my research interest at the time, gun violence and youth violence. And I was assigned to a psychology lab and the project UGIMA, which is now part of the emergency room at Frederick Hospital here in the city of Milwaukee, or Wauwatosa, depending on how you look at geography, that is about intervening once someone has experienced violence, whether directly or secondhand. And I looked at mother-child dyads. So I was interested in how violence impacted a child and how the family supported that child or did not support that child in some cases. And I was looking at what behavior. I was interested in behavior. I had the introduction to medicine and healthcare. Then I was interested in behavior. How do people make choices, or how do circumstances present themselves with certain choices that put people in conditions where it's not the best outcome for them? And who's responsible for that? I wanted to know why. And when wanting to know why, my goal was to create a solution so that we can prevent that from others, so that does not continue to happen to certain people. And then that certain people that don't experience that they can be champions for other people. That has always been a theme for me. So from my Ronald E. McNair Scholars experience, I knew that I wanted to know more about data. So what do people do with numbers? Why are reports important? And who is telling the story? Because data is a story. It's part of storytelling. We have the fetal infant mortality review as a county, and we're a partner as a city, and we have vital statistics. So when you think of vital statistics, you think of birth certificates and death certificates, and names and ways that people die and the symptoms that they experience before they die. So you have those that died before their first birthday, and then those that die after their first birthday. The fetal infant mortality review, the review of the death of infants, looked at telling a story. So when you tell the story of how an infant has passed away, not even reaching childhood, you're looking at the parents, you're looking at the health systems and the education systems those people entered and exit. So each day you go to school, you're part of a education system that you will get into as a freshman and get out of as a senior. When you think of healthcare in the traditional sense, if you come from a home where you have health insurance, you have a medical home. If you don't have health insurance, it's a challenge to have a medical home. And then even when you have this medical home, some folks in that institution look at you differently based on your education status, your income status, and whether or not you have insurance. So there's certain views and beliefs, again, getting back to behavior, that people that represent these institutions, like a hospital, like the school you go to, think of or place value on people that look like me or people that have my experience. So these are all the things I've thought about. So there's only so much one can do as a nurse or a doctor, and there's only so much one can do as a teacher or a coach or after school program director. I traveled on my pathway trying to find this answer. And it wasn't direct. It wasn't A to B to C. It wasn't linear. It was, okay, I've learned this here from this research program. So I'm going to take this class. And then I met this person that does this, but I want to know more about how to do that. So I was open to learning because that's what you do as a student. I think we should all aspire to be lifelong students and learn. Sometimes when you learn so much, you become quote unquote expert, and that qualifies you to have a degree, which qualifies you to get certain experience so you can have a job like the one I have. And a theme for me is, who's telling the story with data? Why do they get to be the storyteller? Are they telling the real story? Because I know my experience. And if you're talking about what you think I experienced and it doesn't match up with what I've experienced, I have an issue with that. And then what does that mean so that I can get into those systems like education and a hospital system or even government? So you have this psychosocial model, right? So that's a fancy word for talking about how do you as an individual engage with your community, so your neighborhood or your larger community like a church within different systems. So you got education, healthcare, and then in the bubble of government and society, how do you fit in all of that? And what does that mean? And if something isn't right, do you speak up? And if when you speak up and someone doesn't value what you're saying, I learned that sometimes you got to get the alphabets, the degrees behind your name. So then they value that you have a degree. So then they pay attention to what you have to say. And that's part of navigating different systems. That's been my experience. So again, thinking of behaviors and decision making that people make as individuals within conditions that allow them to make or not make certain decisions because of feeling included or excluded or that they belong, and then the larger society that sets the tone for how certain people matter and how certain people have access to different things to be able to survive. So for me, it wasn't about medicine because, yeah, I was pre med along with being a psych major. Organic chemistry and I did not get along. I'm not saying that that kills your dream, but you have to ask yourself, how much time are you willing to dedicate to something that may be a challenge? And I repeated OChem 2 times. And after repeating it 2 times, I'm like, there's got to be a different way. And it's okay to say that this doesn't work. That's why you try things out. And that's why you remain open to the process, because it's a process. Again, because something works for one person and they did it a certain way, it doesn't mean that it works for you. We are all on our own journey and we all have our own story to tell, and we can be our own storytellers. From college, I went on to grad school. I was an AHEC intern as well, after being a Ronald E. McNair Scholar through the community health internship program that my AHEC chapter provided, which landed me at the health department. And when I was at the health department, I was looking at and helped to create a directory around mental health resources for the Milwaukee public school system. And the mentor I had, who just left the health department, remembers me and worked well with me and was my introduction to all things city of Milwaukee. So that was Daryl Davidson, who is now the director of the city's Office of African American Affairs. And from that experience, I created a resource that was part of all school districts. I didn't know that when it was my project. In my mind, I'm like, did my project, I'm done. Who wants to work at the health department? Not me, moving on. So, because I mean, again, I'm a millennial, so I'm young, but I'm not a high school student. So when I'm in these rooms, a lot of people look at me as being a high school student because they're seasoned and veterans and close to retirement. So you always have people that like to hold things against you or challenge you because they feel that they can because of your age. That's been my experience. And I could tell that as an undergrad, like, what does this mean when you go to public health? Do you work in public health all your life and then you just retire, or you die on the job? Like that happens. That did happen. I'm not trying to scare you all, but someone died on the job. I'm like, I just
Gosh.
can't. I just can't. That's not for me. But I mean, What's your call? What's your calling? What is your story? What is the way that you think you'll contribute to the world? I guess here I am back at the health department. I wasn't trying to run away from this call. I wasn't trying to run away being a champion for my city. I just didn't feel like there was someone like me that could be in those spaces because I received messages that someone like me couldn't be in those spaces. Like I was only good enough for what I could contribute or do as an output, not because I was good enough because I was Lily Ann. So I came back to the health department because the former commissioner at the time gave me the impression that I could be Lily Ann and help my city and be a champion for my city. And it's important to find people that speak up for you when you're not in the room, value you, and want what's best for you because they're going to try to open doors for you. I can't say that that's always been my experience. I've literally had to create my own path. And there have been some allies along the way, but that has been my experience. So when you think about a career in public health, think about this work as legacy work. This is work that you're working towards that you may not directly benefit from, but you'll have an impact, and you can be that person that can open a door for someone else or change conditions so that the individual can make better decisions that impact the community. Thinking of healthy food choices and food insecurity, thinking of trade schools instead of like a traditional 4-year college experience, and thinking of what it means to get in medicine. You don't have to be a doctor to be in medicine. You can be a physician assistant, and that's just as valuable, and that you help just as many people and you save lives. I was thinking of medicine, and then once I could declare my major and I had my experience with the research project that I did for McNair, I was really interested in pursuing a career in clinical psychology. So I did. I went to a Jesuit school for 1 semester, the most expensive lesson I've ever had. Because again, I came from a family where my mom was first generation. So I did not have support. Student loans was the way I went with what few scholarships I could get along the way. That whole free ride story is an outlier in my experience. It happens, but it doesn't happen for everyone. And even as a McNair scholar, you are given access and certain seats are reserved for you in certain institutions like the Big Ten. But that's because you earn that seat and that institution has dollars to support you. School I went to was part of that system, but did not have dollars to support me. That's why after 1 semester, I'm like, this isn't a good fit. I felt like I was letting so many people down. But that's when you learn, like, again, what's your motivation? Why are you doing what you're doing? Are you fulfilling someone else's dream or is this really your dream? And then you might think it's your dream, but then you learn that it's not. And it's good to learn that earlier on. And that's what I learned. And that solidified my interest in public health because I saw how therapists provided one-on-one and talked about behavior modification and maladaptive behaviors and provided medicine sometimes to be an addition or supplement for the therapy that people received. But you're sending those same folks that were injured through violence or did self injury in an environment where there's cues that say, just go back to what you were doing, not support for trying to think differently or process differently or even maintain medicine to get better. So, what does that mean? There's some policy changes that have to be made. So, I was thinking of policy, but I don't want to be a politician. That's like me saying, I don't want to work at the health department. Now I'm like, I don't want to be a politician. But yet, as chief of staff, what am I doing? Politics. I'm advising the commissioner. I'm advising our deputy commissioners. At times, I am advising and debriefing our mayor. I do a lot of our public relations stuff. I'm like an understudy for the commissioner. Do I want to be health commissioner today, right now? Nope. I'm happy to be on the health commissioner's team. And before COVID, when there were media releases and media conferences, you would always see me in the back because what am I doing? Before we go out, I'm briefing the mayor, I'm briefing the team. Before we get to the point of briefing someone, I'm gathering information from our program managers and directors that are our content experts on a particular matter. So pre-COVID, it was flu season when I came back. So that's what we did a lot of media about, radio shows, connecting the commissioner with media opportunities. So a lot of podcasts and then a lot of community engagement. I mean, the theme or the mission of the health department and the vision of the health department is living your best life in Milwaukee. And we want to advance health equity and health of our Milwaukeeans through science, innovation, and leadership. And that's what I do. That makes me political because of the people I'm connected with and the health messaging that I'm a part of creating, as well as helping to maintain daily operations of our health departments.
Liliana, I was just going to add real quick too. I know you said at the beginning you became very maybe frustrated with some of the systems, and I think when we talk about the policy side of it, when you really try to tackle changing some of those systems and those structures, policy ends up being the place where you have the greatest impact. So thank you for making that contribution to our communities. And I had a quick question. Some of them are coming in to me from like the private message, so you might not be seeing them in
Okay,
there.
good.
And one of the students was wondering about the type of like people that work in public health. Like, are they more research based or are they clinical based? Like, are they a bunch of different types of careers?
I mean, public health is a new science and it umbrellaed under the social science. It's less than 100 years old. And it takes a little bit from social welfare, social work, it takes a little bit from political science, it takes a little bit from biology and chemistry, and it takes a little bit of urban planning. It's a mix, and you can do so much with that training. So clinically speaking, yes, our lab folks have that. They are our scientists, our traditional scientists. So they have a degree in chemistry or biology, or they were pharmacists at one time and decided to come to government level work instead of your traditional systems like Walgreens and CVS, those direct service provider folk. When I think of our branches, so we have our medical services that is led by a medical director. We have our consumer and environmental health. We have our community health and our policy, innovation, and engagement branches. And then lab. And most folks have a public health degree. If they don't have a public health degree, they have a PhD. If they don't have a PhD, they have a medical degree like our medical director. And their experience has been around healthcare administration or emergency preparedness or having a concentration in policy and community behavioral health. So, yeah, a degree is like once you have it, that lets others know that you know a little something about a lot of things and that they can trust you and lean on you to help gather data that can help tell the larger story of public health and create conditions where families can thrive and be their full selves and live their best lives.
I like how you loop that back to the ability to trust and to the first part of our presentation. Just a quick question someone else quickly asked. The public health degree, is that like an undergraduate degree or is that like a master's or PhD level?
Right. Again, tradition, let tradition tell it. And here in the state of Wisconsin, the University of Wisconsin-Milwaukee has received accreditation for the master's program as well as the PhD program. And there's different concentrations or different tracks. I think in the last year, their first cohort for the undergrad in public health has begun. So UW Milwaukee, UW Madison, I believe they've had programs set up for MDs to get PhDs or to get MPHs, and typically that's been in epidemiology. I think it's expanding as well since its inception. And then when I think of the medical college, again, that's traditionally been a focus on epidemiology, trying to build the capacity of medical physicians, but it has expanded. And again, there's different tracks.
Awesome. Well, I actually want to get back to talking about you because I love your passion and enthusiasm for this. So in the work that you do, like what would you say is your most favorite thing that you like to do?
Oh, that's a good question. I would love for you all to take time to look at some videos that will be shared after today's presentation and then to explore what I will share now. So I'm back at the health department. Prior to working in this role, I was with UW Extension, Milwaukee County's office. I was the health and well-being educator, and I was tasked with looking at food systems and health systems with a financial equity lens. So, as an educator, what does that mean? That means that I do program planning. That means that I do fundraising. That means I do evaluation, recruitment, curriculum. I was doing all those things. And before you jump into creating a program, what do? You gather data so you can tell a story about what the need is, right? So I did a lot of key informant interviews. So that's basically sitting down one-on-one with people that represent different systems or sectors, trying to better understand what already exists when looking at financial capability. And financial capability is fancy word, right, for choice. What choices do you have when it comes to your money? How do you get money? How do you save money? And then are you secure with the money that you have, right? So looking at people that work for FDIC, so that's the federal folks when it comes to insurance and deposits of money into banks, looking at different coalitions that do direct service. So they're doing one-on-one or collectively as one entity helping a group of people get connected to banking, or after school programs that build the knowledge and help to create the behavior of littles. And when I think of littles, I'm thinking of like your kindergartners, middle school. I wouldn't call you all littles as high school students, but then again, there's a huge age gap between you and I. So just like I'm seen as someone that's on the younger end, I see you as someone on the younger end, but as representatives of the future. For me, sometimes I'm looked at as a threat because people think I'm trying to come for their job, and I'm not. I'm trying to be happy with where I'm at and affect change at this level. And I say that all the time when I enter certain rooms, just being real, just being real.
That's great.
So, yeah, with that, I looked at what I could do from my position, having that network of coming from the health department, coming from clinical research background, working at the medical college, and then working at the county. What could Lillian do? I was recognized for my work by the Wisconsin Public Health Association from the time I left the health department to working at Extension around my efforts to bring reproductive justice framework into the work of maternal and child health. So starting out with those mother-child relationships when I was interested in youth and gun violence to looking at infant mortality. So why do infants die before their first birthday? And then looking at the larger context of community and government. So life course, how do you enter and exit systems across your lifespan from cradle to grave? And working at the ground level. So those that are part of churches, those that you have your neighborhood go-to person that in your mind at the neighborhood level, per the zip code you live in, they're deemed a leader in your community. And then you have aldermanic representatives in districts that are deemed a leader because they're appointed or voted into positions. And having to work with those people and understand why they do what they do, again, thinking of behavior, why they make the choices that they do, because they can or because that's what's available to them, with my goal of lifting up and increasing people's ability to be healthy and to make better choices. So I say that to say, I was recognized by the Wisconsin Public Health Association in 2016 for my excellence in health education and promotion and social justice, I believe. And it was nice to be recognized, but what was the award for? For people that value those awards, to them, I mattered all of a sudden. To people that values those awards, they wanted to nominate me to be on boards. So in my mind, I'm like, "Oh, so this is what you do at this level. Once you have a degree and you've worked a little bit, people recognize you and you have some influence now. So who was I representing and whose story was I telling and what change was I trying to make and how could I do that? Did I really want to be on the board? Did I really feel special because someone that didn't recognize me before recognizes me now? These are thoughts that you have, and people say sometimes you experience imposter syndrome, thinking, are you good enough? Are you the right person? Do you really deserve this? And then someone like myself, I identify as Black. I am cisgender, so I believe in the traditional role of being a female, that I was assigned that gender at birth and I follow that. And then I also think of what is my position politically speaking, and what is my position as I represent institutions. I think of all those things. So a fancy word for that you can look up if you aren't familiar with already is intersectionality. So not just how it impacts me and those that look like me, but what does that mean for the larger family unit? And what does that mean for institutions? Again, when you think of building trust. So in my mind, to do my job, to build financial capabilities within health and food systems, I accepted a nomination to be on the Wisconsin Public Health Association's board of directors. And what does WPHA do? They train the people that I remembered working with that I didn't want to go work at the health department. So I didn't want someone else to have that experience and say, I don't want to work at the health department. So I was in a position of authority with influence to say this, we should do things differently. And I took a risk with that, right? My term was 3 years. So from 2017 to 2019. And that was a painful experience. It is not easy being the first at anything. It is not easy always speaking up. It is not easy always having to be the person that says, but what if we thought about it this way? So you have to find people that, again, are champions for you, can speak up for you when you're not in the room. And I took that risk. I took that calculated risk because I had a vision based on my experience from being a high school student to now, and knowing what those stories are with the data and knowing who those storytellers are and lifting up their experience so that when we train those that represent those systems that they enter and exit, education, healthcare, hospital systems, that they do things differently. So the racism as a public health crisis, not a lot of people associate that with me because how is the story being told and who is telling the story, right? That's the question. So I haven't always been given the opportunity to speak my truth about that experience, but I see the impact of my work. I see the impact of speaking up and creating a framework and sharing ideas with others so that if they're not heard by me, they're heard by someone else, and at least the work gets done. And I think of 2017 to 2019, and then the pandemic happened. And we're using that framework at the health department to become the first jurisdiction to look at our dashboard data with race and ethnicity. Like, can I say all of that was worth it? We'll look back in history and tell, and I can say at least I was a part of that.
That's awesome. That's really awesome. You know, one of the other things too, we had another student message in. So your message has been very inspiring this morning. And at the beginning, you talked about some research that you did around youth violence. And one of our students was wondering, like, how would they get involved in something like that? And is there things that they should be doing in high school that could help prepare them to get involved in research and then, you know, activate change around larger topics like that?
Yeah, so things are hard with the pandemic and the restrictions of gathering and meeting in person. Because my first thought would be to volunteer. So, how do you volunteer virtually? I know
Via
as
Zoom.
as a health department representative, we review COVID safety plans. So when anyone has an event, think of sporting events or a community event, it is good practice for them to work with us to create a safety plan. How are they going to prevent the spread of COVID? So knowing that those things exist and knowing that our gathering limits are what they are, there may be some opportunity to volunteer outside, where there's ventilation and space, but that would be determined by whichever institution you hope to volunteer at. Because it's about knowing who's doing the work. So, say you follow like the Black Lives Matter movement and you see the names of some people, some movement builders, or a name is referenced a few times when you think about a certain subject matter. So, Dr. Kamara Jones, she's my public health hero, someone I've been able to meet and now work with. Again, I didn't know this is how my life was going to work out, but you Google their name. What institution do they work at? Do they have a public facing email address? You email them and say, hey, I think you're cool. I want to be cool like you when I grow up. What can I do? I think also reading. It's a good time to read. Again, referencing the videos that will be shared. Learn as much as you can just because you want to, not because you have to. And then follow people on social media. Think of, those quizzes that BuzzFeed does or Teen Vogue, 21 questions that some celebrities do for YouTube shows. Think of 21 questions that you would like to ask someone. Like, we can use me as an example. What 21 questions would you like to ask me? And then from that experience, does that help you want to explore something in education as far as getting a degree? Or does that help you want to explore what summer program you could do to help get you ready to apply to be a part of, continuing your education experience, or apply to be a part of a group that does what we call coalition work. So changing hearts and minds of people for different causes. That's what comes to mind. For a high school student, yeah, don't allow people to put pressure on you right now. Yes, respect your elders. Yes, respect your guardians, but really try to figure out what you like and what you can't live without. Like, you have to do this. It's a must do. not a want to.
Yeah, that's great. And we probably really only have time for one more question. I feel like this hour has come very, very quickly here. And one of our last questions, Finian's asking is, you've obviously worked at the health department pre-COVID, as you said, and during COVID. So how has this pandemic like shifted the focus of the work that you're doing, or how has it redirected what you're working on?
That's a great question. As chief of staff, I have to know what each branch is doing so that if someone from the mayor's cabinet, other than the health department, has questions or there's questions with the media, I can be a spokesperson. Typically, our health commissioner is that spokesperson, but again, I'm her understudy. So if something comes up, I need to know. So it's a challenge to text or message someone that may be out at, for example, the Wisconsin Center right now giving out vaccines. But if I have a question, they have to make time to answer my question. Or like when we have employee orientation, new employee orientation, I try to join those orientations so that they know my face, know my name, know how to reach me if they have questions. I am accessible. I have to be to the people that work at the health department.
And to any of these students, right?
Oh, for sure, for
Yeah,
sure,
I
for
know.
sure.
Yeah, well, so let's just frame it up. If you had a last bit of advice just to share with the students here, we have a lot of some of the questions that are coming in. It feels like they have a lot of interest in being able to help somewhere in healthcare, somehow give back. What
Yeah.
would you share with these students that want to help? Where should they start right now? And then, if there's any other resources too, we can send that out to the group after as well.
Yeah. I mean, one struggle that we've had with this pandemic, and it just speaks to structural issues that existed that are being exposed in this pandemic, is how to get the word out to people that need to know what to do first because of we look at the story, how many people are dying, who are dying, what resources are available to them geographically, and then how do we make it make sense because of the lack of trust that communities have with institutions that have to prove that they're trustworthy. So I think of messaging, and a video that will go out to you all as a parody of Cardi B's WAP, but it's John Hopkins School of Public Health WAP, wear a mask, please. So think of how you can use your creativity, your artistic sides, or your STEM experience with creating messaging to your peers about why you should take COVID seriously and why you should practice washing your hands, wearing a mask, and practicing physical distancing because that's what's available to us right now in this pandemic. That's been a struggle, messaging, because not everyone watches the news like today's media day. So the mayor and the commissioner are going to do media where channel 6, 4, 12, 58, CBS, ABC, TMJ4, they get to ask all the questions. But again, remember who's telling the story, who's asking the questions, why are they asking the questions, and then what are they doing with that information? I want you all to put your thinking caps on and be detectives. Get down to the root of, is this the right message? Is this the correct message? And who are they not valuing or including in the message?
Awesome. Thank you so much for sharing your expertise with us today. And students will, I know Lily Ann has some YouTube links on like what is public health and a little bit more information around COVID, and we'll share those resources with you too in the follow-up email. But again, thank you so much for your time. We appreciate hearing about your story. I think today you really showcased to us the importance of storytelling and even understanding how numbers are used to help tell stories as we continue to learn and grow in our lives. So thank you again for your time today, and thanks for
Yeah.
sharing your insight with these
And
students.
any questions you have, when I said I'm accessible to the health department, I mean, I'm going to value answering the phone of a peer at the health department versus a media person that's just trying to not tell the true story.
Yeah.
That's what I mean by accessible. So yes, I'm accessible to you all. You can send questions to Nikki and they can get back to me and we can try to connect that way.
Perfect. Awesome. Thank you so much, and have a great rest of your day for all the students that are logged on.
Yes, have a good rest of your day. Thank you all.